Okay, so this is the overview of the Wireman arteries. Starting at the heart, this is the ascending aorta. At the arch, you have three branches. The first is the Brachiocephalic Artery. It branches into the right subclavian artery, then the right common carotid artery. The second branch is the left common carotid artery, which branches into the external carotid artery and internal carotid artery. The external goes out towards the face. The internal goes in towards the brain. Both the left and the right common carotid arteries do this. Here in the back are the vertebral arteries. They come off of here, the brachiocephalic artery, and then also right here. This is the third branch off the aortic arch, and this is the left subclavian artery. We'll follow this one down the arm. Here it turns into the left axillary artery, and the brachial artery. Most lateral, it is the radial artery, and then medial, it is the ulnar artery. Here it is the palmar arches, and then the digital arteries of the fingers. Now if we turn this to the side, we can continue down the descending aorta behind the heart. So this is considered the thoracic aorta. Coming off the thoracic aorta, these are the intercostal arteries that go out towards the ribs. And then once you pass through the diaphragm, which is represented by this blue structure here, the aorta becomes the abdominal aorta, so it just continues down. The first exit off the abdominal aorta is the celiac trunk right here, and there are three exits off the celiac trunk itself. The first is the splenic artery that goes towards the spleen. The second is the gastric artery that circles the stomach. And then the third is the hepatic artery that goes towards the liver. So again, there are three exits off the celiac trunk. The first is the splenic artery that goes to the spleen, the gastric that circles the stomach, and then the hepatic that goes towards the liver. The next major exit off the abdominal aorta is the superior mesenteric artery right here. Goes to the small and large intestine. Then it is the renal arteries right here. They go to the kidneys, the left right here. And then on this side, the right renal artery. Okay. Right after the renal arteries are the gonadal arteries. They're very small, almost like dental floss. You probably see it best right here. These very tiny ones, they come right after the renal arteries. They go down to the ovaries and testes. Immediately following those, you have the next major exit off the abdominal aorta, and that's the inferior mesenteric artery. It goes to the large intestine. So it starts right here, goes down. Then if we continue down the abdominal aorta, it becomes the common iliac artery. Here it splits into the external iliac, the right and the left common, or the right and left, sorry, external iliac artery, and then the internal, you have a right and left of these two. And then if we follow the external iliac artery down, it becomes the femoral, then the popliteal artery, then out towards the front. This is the anterior tibial artery. Then on the back side, the most medial one is the posterior tibial artery. The most lateral right here is the fibular artery. Following the anterior tibial artery down, you have the dorsal pedus, and then these right here that come out are the digital arteries that go out towards the toes. Okay, that concludes the Wireman overview for the arteries.